Hello, my dear viewers. Welcome back to your health channel. It's SL Health Podcast. I'm Dr. Prabhat. It's the same series we are continuing with. It's about chest pain. Today also we are going to discuss about. We discussed about sinister causes of chest pain, and we discussed that every chest pain should be attended by a medical person, maybe face to face, maybe virtual, maybe a telephone call, and somehow it should be triaged and you should be treated properly in a proper healthcare system. But I would like to explain further how you are going to know whether you are going to have a heart attack. Here, I'm only going to discuss few things about what are the symptoms which can predict you are going to have a heart attack. Basically, heart attack is clogging of a artery which supplies blood to the cardiac muscle. That is basically which is called a coronary artery. Then how you are going to know you are having narrowing of a coronary artery? These symptoms which occurs during the heart attack is due to a rupture of a plaque in this coronary vessel. Therefore, developing of a plaque, if somebody can identify development of a plaque over a period of time, then the prediction can be done whether you are going to have a heart attack or not, because the heart attack is due to a rupture of a plaque. The plaque is not a normal thing to occur in a coronary artery. It occurs due to cholesterol deposition beneath the superficial surface of the which is called endothelium, beneath the endothelium of the coronary artery. It goes on happening over time, and atherosclerosis occurs. It is a process which leading to a plaque in a blood vessel. And when a plaque occurs gradually, the blood flow can get reduced. Therefore, some patients show up symptoms of chest pain upon exertion, not in all patients. Therefore, a patient who is having chest pain upon exertion, or sometimes shortness of breath and chest pain, may be having narrowing of a coronary artery due to atherosclerotic plaque. And that kind of patient who is having a plaque in a coronary artery is at high risk of rupture of a plaque. The rupture of a plaque, what will it really do? It bleed, it causes a blood clot, which causes sudden occlusion of that blood vessel, which has been getting narrowed over time due to atherosclerotic plaque. Therefore, heart attack and chest pain upon exertion, in other words, which is called angina, are totally different but totally related to conditions. Therefore, any person who is having angina should seek medical attention, because there is high risk of getting acute heart attack and high risk of mortality and morbidity. That means high risk of death and high risk of impairment of function and disability due to the disease. But the good thing is, angina can be found a lot of people before the onset of acute heart attack. Therefore, if a person who is getting angina can be treated, or who getting angina can be intervened by a cardiologist or a physician, then risk of getting an acute heart attack can be reduced. That is a good thing. There are medications which can be used. Most of the patients know about it. Most of the general public know about it. That is aspirin. It is the first medication used a couple of decades before, which showed evidence of reducing the risk of getting a heart attack in a patient with angina, and reducing the risk of getting the second heart attack in a patient who has already got a heart attack. Other medication is statin, I think most of the people know about these medications. Therefore, the take home message: never ignore a chest pain or chest pain with shortness of breath. If you get it when you exert climbing up a staircase, or maybe climbing up a maybe you're walking on a flat ground. Previously, you would have been able to walk miles without any problem. If the distance without getting any chest pain or without getting any shortness of breath getting, if it is getting shorter and shorter, then you can't walk without getting a shortness of breath, or you can't walk without getting chest pain for a certain distance. If the distance becomes shorter and shorter and you think you are getting any chest pain upon exertion which is not normal to you, go to a doctor. Okay, bye bye.